Hi.
Dr. B and Dr. J, Texas Functional Health Centers. We'll sit around and talk a little bit, wait for people to join.
Yeah.
Enjoying our nice cooler weather here in Texas.
Finally
feels like fall.
It does feel like fall.
At least it's 70 something today.
Yeah, that is true. Like during the afternoon is pretty good.
Right,
I like it. Yeah.
Morning's a little chilly, but not bad. Get the feelings. At least it feels like fall.
It does.
All the pumpkin spice
I know.
lattes are
All
coming
the
out. All that good stuff. And start
everything at
soup.
Starbucks.
Right.
Yeah.
All the soup and everything. All right. So we give it a couple seconds. All right. Today's topic. We're gonna go there. We're gonna talk about sex. Right.
Yeah. So like if children are in the room, this would be the moment to like not be in the room with them.
We're gonna keep it upper level.
Right? Yeah, so
definitely
for sure.
More medical.
Yeah.
In the scenario there.
Yeah,
so
it's science based.
We're avoiding most of the taboo scenario, so it's not no reason to blush or get excited. Right. And so we're just talking about the way the body. So we think the posture, the framework, the nervous system, and everything interacts with the entire body. But we're going to talk about one of the big things that we see in our practice is that a lot of people complain about not being able to do something, and this is one of those things or some things that they can't do anymore, and puts a real bind on their life, their marriages, their relationships. And so we wanted to touch base on that, talk about the parts and pieces that are involved and why it's so important that we can make sure we can keep doing that.
Yeah.
Right.
So whenever patients come in, one of the main questions that we ask is like, why? Like, why now? Like, why is this a big deal to you? What are you having issues with? Like, what are your goals? What do you want to get back to doing? And often this is one of the issues that come up. You know, they say, I'm not able to be intimate with my partner anymore, or we're struggling, or whenever I do certain things, it is
no good anymore.
Right. It's not working. It's uncomfortable. I'm having issues and I need to get over that.
Right. And males and females alike. Lots of interactions, lots of parts and pieces that are similar between the two, and lots of things that are different between the two. So I get it from all walks of life, old people, young people, everything in between. So it's not any one particular person or one particular problem that would lead to this kind of scenario. So we'll touch on the parts and pieces that are involved, why it's important that those parts and pieces work, and we'll go on from there. So let's talk about the nervous system first. So every cell in your body is controlled by a nerve that goes through your spine. So when we think of the pelvis and the lower back, all the things down there tell us how those things down there work. So it tells us what they feel. It tells them how to function. Males alone have some issues with the parasympathetic nervous system. That's the thing that tells it how to work. So it tells it to get going and do its job. Yeah. So that parasympathetic nervous system, if it has any kind of issues, so pressures, miscommunications, that thing makes it where we can't get the party started. And so we see a lot of problems with lower back pain, pelvis issues, making it where it's difficult for them to even get the process going in the first place.
Right.
A lot of patients, more often than not, it's an anecdotal thing on our part. We'll see that as we get the lower back functioning, we take the pressure off those nerves, it starts to work better. And I said, well, you know what? It does its job a little faster, a little easier. It's getting there. I don't have to have as much help making it do its job. And so we get a lot of those responses from the males. The females, mostly it's going to be discomfort. So arousal and discomfort. When we have those problems with the nervous system, it's really difficult to get aroused. We're just not interested in it. And then when we do start doing things, it's very uncomfortable. So they feel some pains and discomforts that they normally wouldn't feel. Makes it very difficult for them. And so definitely the arousal of the system is going to be associated with the nervous system. And so that's definitely one of the big things that we address in the office is making sure that the nervous system is happy and healthy via the movement of the lumbar spine and the pelvis.
Yeah. And so we have to think of the nervous system as just a communication system. So if we're not able to communicate with the sexual organs and things like that, then they're not going to be told what to do.
Yep.
Right? They're not ever getting that message, or at least it's spotty, or at least it's unclear. So it's not moving as fluidly as we would wish.
Right. And so that's definitely one of the big complications that we'll see within the office is just that things stop working.
Yeah.
That definitely will put a hamper or difficulty on being able to perform or being intimate with your partner.
So if you ever needed a better reason to like, right, to like take care of your back, if you ever needed a better reason as to, oh, it's not that bad now, I'll just put it off. Right. There could be some things that you're not really aware of that it is affecting, or you didn't really know that they were associated.
Right. Didn't think it could be involved.
Right. Yeah. 100%. Because I mean, like a regular person wouldn't think that. I don't think.
Yeah.
Because they seem so far detached, because they seem like they're different areas, right?
There's not a bone in there.
Right. Yeah. Like, please don't adjust that.
Right. Yeah. It's really very interesting how much the nervous system is involved with every part and piece of our body. It tells every single cell what to do. And so we need to make sure that it's working the way that it's supposed to optimally. These nerve cells tell even our blood vessels what to do.
Right.
And so even if we just have blood flow issues, so we go to the doctor and they're like, hey, I'm going to give you some Cialis to make this work a little bit better. Really, all the Cialis is doing is increasing the blood flow to our parts and pieces. Most of the medications that were designed for that came from high blood pressure medications.
Right. I was about to say that. Yeah.
A fortunate side effect whenever they were doing the studies on it. They were like, oh, so Viagra's initial test was, hey, we're going to try and reduce the peripheral pressure. So open up the blood vessels in the periphery so we have a lower blood pressure. Certainly lowers the blood pressure a little bit, but it makes everything work a little bit too well. So unfortunate side effect, I couldn't walk around with a boner all day, but my blood pressure was better. So we remarketed it, and now we have an off-label use of Viagra. Right? So the nervous system controls a lot of what the blood vessels are doing, what our systems are telling those blood vessels to do. And so we need that nervous system to work the way it's supposed to.
Yeah.
And that's what chiropractic is all about, is making sure that the nerves are happy, healthy, communicating to and from those parts and pieces to make them work. So all the way from arousal, willingness is definitely part of it. So willingness, arousal, and culmination, all parts of those pieces need those nerves to work the way they're supposed to.
Yeah.
So super, super, super important. And then we can get to the basic, like normal thing. So mechanics. I need my lower back to work.
Yeah.
I need my pelvis to work, and I need my hips to work in order to perform any of these activities.
Yeah, any of these tasks, situations, events.
I mean, even if I'm just laying on my back doing a whole lot of nothing, if my back hurts, it's not going to work.
Right. Oh, yeah. No. And that is definitely going to put a hamper on some things.
Yeah.
Right. If you're in pain, it's just not going to be fun. It just, I mean, there's no getting around that.
Right. And then you start developing a ton of anxiety and then performance anxiety, and that leads to even more problems.
Yeah.
And so now all of a sudden we don't want to, and then we're kind of grumpy because we're not doing it.
Yeah.
And wife's going, why are you so mad all the time? I need something, but I can't do something. And I'm really ashamed that I can't do something all of a sudden. So a lot of times.
Very cyclical.
Right. And there's unfortunately, a lot of taboo communication around sex for everybody, so it's really difficult.
And so people don't really talk about it either.
Right. A lot of males have a hard time communicating with their partner that, my back hurts, I can't perform today.
Right. Yeah.
Right. They're not willing to do that. They're like, oh, I'm gonna muster it up. Let's get it going, and they're dying going through the process. So really, just the mechanics of the system need to work the way they're supposed to.
For men and women. Yeah.
Very much
for
so.
sure.
I mean, hip mobility for the females is so important. If you can't move your hips, it's going to be really difficult for any of the positions, whether they're benign or extreme, to work the way that they're supposed to. So we need the hips to move. We need the pelvis to move in these situations. Otherwise, it's just not going to work the way it's supposed to.
Yeah. I mean, the goal to get back in the gym is great.
Yeah, for sure.
For sure.
Work out,
Yeah.
Do this basic human function.
Yeah, but these basic human functions, that's life changing.
Super important there. So a lot of things that we'll focus on are going to be hip mobilities, male and female, but especially in the females, making sure the pelvis is moving the way that it's supposed to. And so we do a tremendous amount of assessment for the function of the pelvis and the parts and pieces. The other thing with the female pelvis is that every structure is attached to the pelvis. So if we have a big misalignment of the pelvis, all of a sudden all the structures that are associated with intercourse are going to be affected too. So
and weaknesses, like whenever women notoriously have tons of weakness, and like that just seems to be the way it is. A lot of women, they most women don't work out after high school in all reality, but also whenever we're talking about having children, right? You have to build everything up, right? So I've had 4 children, and you have to build everything up again
from scratch,
right? Because everything gets shredded. And if you're not doing that, you are going to be on the struggle bus. You are going to have issues. But also kind of back to what you were saying, misalignment. Whenever we do give birth and through that whole process, we have to become very lax in order to move and have the baby situate the way that it needs to in order for you to actually deliver the child. And through that process, everything gets moved, literally. And if it doesn't get moved back in the correct position, it gets stuck like that. And that will definitely hinder intimacy.
Incontinence. So
yeah,
one of the most common things that we'll see in a female.
Yes, I'm so glad you brought that up.
It's like 1/3 of women before they're 40 are going to develop incontinence regardless of having a baby.
Honestly, this is one of the main topics that I get, just not necessarily in the office as well, but within like friend groups. I like to go jump on the trampoline with the kids and be active and outside. And I'm often asked, how do you do that?
How can you still do that?
How can you still do that? And I have to walk them back through what got them in their situation in the first place, and that you can come back from it, you can reverse from it. But like you were saying, like it is like a topic of, like concern, but also like embarrassment. Yeah, for sure.
And like for me being a male, a lot of times my female patients don't want to talk to me about these things.
Right.
So a lot of disclosure happens between either my female rehab techs or my female doctors in the office. And so they'll communicate some of those issues, and then we have to have a little conversation on the side. Like, it doesn't bother me at all to talk about this.
Right.
This is the things that we need to do to get this back.
Right. Yeah.
The guys are way worse. They don't want to talk about nothing.
No. It's like it doesn't even happen.
Yeah.
Women like will like get to a certain point and get comfortable with you, and then kind of lead into it. But the guys are like, no,
never going to admit to another male that things don't work.
Yeah. Which is unfortunate. It's so unfortunate.
And a lot of times it's really the wife bringing it up to me, but usually not the guy that's going to bring up the process. So, let's see.
Yeah. So like take that and go with it. Like if you are having problems, you're a guy, don't be ashamed. Like reach out, figure something out for sure. If you happen to be in Dallas,
be happy to help you out.
Yeah, we're here. Let us know. See what we could do for you, all of that. But reach out to someone.
Right. And within our functional medicine side of things, so not just the way that the body works, the nervous system, but what nutrients, what other metabolic systems are involved with it.
Yeah.
A lot of times through a number of different interactions, we can come up with a decent solution that's non-pharmaceutical, that's not going to damage your body. It's not going to make things worse down the road.
Right. It makes it to where you don't have to take a pill.
Yeah.
And things just work.
Yeah.
Which is always a winner.
Right. And I mean,
for like short term and long term, all better.
Unfortunately, nowadays, it's becoming more and more common that the stresses of life, the anxiety, everything else are making it difficult for younger men to get this job done. So they're marketing more and more of these pharmaceuticals that help you perform to younger and younger crowds. So we're seeing it in, they're marketing for like 30-year-olds, 35-year-olds, which is a pretty wild thing.
Right. Like that's young.
Right. You should still function pretty well in your 30s.
Yeah,
40s
for sure.
and 50s. It should still work. So usually there's some metabolic condition that's underlying in the background. If you're just
Mm-hmm.
taking some pill to make it work for the moment, uh,
Mm,
let's do something a little bit more to dig to
yeah.
the root of
Yeah.
it.
Because whatever the cause is, it's just going to keep compiling until
Then
you
eventually the pill
actually,
doesn't work.
right. Yeah. Which is not a winner, especially if we're starting off at like 30,
Mm-mm.
right? Like bad news bears.
Right. And back to the nervous system. So the drive for the male and the female for arousal and initial function comes from the parasympathetic system. So most of the time you're going to hear anxiety, fight or flight, the sympathetic response. So we get this really big dominance of our sympathetic side of things. So our body's always in this emergency, hey, we're going to die all the time. So the
Yeah.
anxiety, the overwhelmingness, difficulty sleeping, all these things start to pile up. And the busier we are as humans, the more that piles up. That sympathetic overdrive starts to tamp down the parasympathetic drive. So that's what makes it more difficult for men and women to become aroused or even be interested in it. So we're seeing that at a younger age. We got to do some things that help get our parasympathetic or our calming
Right.
side
The
down a
calming
little bit
side.
better.
Yeah.
And so a lot of what we're doing is getting the systems calmed down, so we have less of that anxiety and angst. We sleep better, we function better.
Because whenever we're having chronic pain or dysfunction, our sympathetic system is going up. It's going crazy. Our cortisol levels are going up. It's crazy, right? And we've probably all kind of heard of cortisol, right? Associated with stress, anxiety, right?
Right. And the culmination or so premature ejaculation within men, it's because that sympathetic system's overdriven.
Right. Yeah.
So a lot of times we're like, man, I just can't do what I used to do. It doesn't last very long.
Yeah.
It's because you're just overwhelmed and freaking out all the time. So we got to do some different things to calm the systems down, calm you down, give you some tools to manage all this anxiety in your life. So we could not just get it going, but we can make it work like it's supposed to for the situation. So a lot of things that we do in the office that help within that. Lots of functional medicine offices. So you find a true functional medicine doctor. So somebody that's actually going to analyze the way that your body works, not just do some basic blood work tests, but how your body's functioning, what parts and pieces are involved.
Yeah.
They'll be able to help you navigate this process and what you need to do to get your systems balanced again so that you can perform like a 30-year-old should.
Yeah. Sure.
And then mechanically, chiropractor, physical therapist, those kinds of people are going to help us get things moving. So hip mobility, pelvic mobility, lumbar stability, and range of motion, that's going to help us on that side too. So a lot of factors involved with having sex.
Right.
And so we need a lot of these factors to come together at the same time in order for it to work. More often than not, again, females, a lot of patients will tell me that, I'm having a difficult time performing in bed. I'm intimate with my significant other, so usually a husband, making it difficult for our relationship. Usually as we get about 3, maybe 4 weeks through therapy or care, they're just happier, they're more glowy and everything else. I'm kind of, hey, what changed? Like my hip actually moves now. And so I don't get that cracking and popping every time that I'm on top.
Oh yeah,
I don't have
for
that
sure.
Pain in my deep, right? I don't have this deep pain every time that we make love. And it makes a huge difference in the outcome of their life.
Right.
And I mean, just last week, a very young patient, she's 25.
Yeah.
25. And every time, brand new, just got married. Every time she was having sex, lots of pain. Lots and lots of pain. And so it was really tailbone. Her tailbone wasn't in the right position. We got her tailbone moving. She's good.
Oh, don't you love that? I love that.
No problem with that now.
Yeah.
So she's very grateful that we figured that out.
Okay, yeah.
She's been suffering for time.
Okay, but is that the reason she came in?
No.
Yeah.
Right. It's just something we found on the side.
Exactly. Yep. And so oftentimes people will come in and they'll ask us, like, why are you going through all these questions, all this stuff? We go through all this because we're doctors. Because going through a doctorate program, you understand the body, and that's our job. That's our job. That's not your job. That's our job. So we ask you all these questions because we know that things are related, and we know, oh, hey, might help with this, might help with this, might help with this.
Well, I mean, the vast majority of people don't know that it has anything to do with it.
Right, of course, right?
Headaches in the office all the time. People are like, you can help me with a headache? Of course I can.
Right, yeah.
And so it's super interesting, and that's why we do what we do. We love helping people. We love getting people back to normal life and whatever that thing is that they need to do, especially keeping the relationships happy and healthy.
Yeah, because I mean, like if if you're yeah, I mean obviously it's not everybody's going to be snowboarding,
Mm-mm.
right? But most people the goal is to have a healthy, intimate life.
Mm-hmm.
So
We all want a good love life.
yeah.
And if that doesn't work, we all get grumpy. It's just not good.
Yeah, no one wants that.
Right?
Yeah.
So a big thing to check out, like for most people, can you do a deep squat without any pain? And by deep
Yeah.
squat, I mean like butt to the ground,
All the way
flat
down.
feet, like deep
And can
squat.
you get up? Right? Like it's not just like, can you get down there? Can you get back up?
In the females, it's going to be like, can you do that and not feel like your pelvic floor is falling out?
Yeah, because there is a very specific feeling
Mm-hmm.
to when you think that your innards are going to fall out.
Right.
And you can definitely tell the difference when it's not that way.
Right. For guys, do you have to round your back all the way down to get into that position, or can you maintain a straight back?
Mhm.
That's going to have a lot to do with your hip flexion mobility and your pelvis mobility. And it's really hard to do even just the basic 2 procedures for normal lovemaking if your pelvis doesn't work. You're going to sit there catching cramps in your calves because you can't get in the position that you're looking for. So really, that's one of the big assessments that we use in the office is a deep squat. So can you do this deep squat? Can you make that happen for us? We can glean a tremendous amount of information watching you do a squat.
Oh, oh, I know, right? And another one that I really, really like is, can you sit down in a chair, not like flop down in a chair, right? Can you gently sit down in a chair and then gently rise from the chair?
Without using your hands?
Yes, because all of the musculature that you need that's going to be important for lovemaking are the same muscles that you are going to use in order to squat, to sit down. So it'll tell you a whole lot about you and what's kind of going on.
Yep. And so just want your body to work the way it's supposed to. Check yourself out. If you're having some kind of issues, you're seeing like the beginnings of this, you can get some help.
Yeah.
All right. Let's
get it fixed
earlier. Not to the point that
earlier.
it doesn't work or you can't do it. We're like, that didn't feel so good this time. Go get it fixed.
Yeah, for sure.
Go find somebody that's going to help you with that. So keep your mobility up, keep your muscles working. Posture has a tremendous amount to do with this. So if you notice that your posture has just been getting worse and worse year over year, at some point you're going to find some symptoms. This may happen to be one of those symptoms for you.
Yeah.
So before it gets off the rails, while your body's just barely talking to you in the background, going, "Hey, I don't feel so great."
Yeah.
Go get something done.
Right. Go take care of it.
Right. I mean, hell, even just go get some stretching, do some yoga, like use your body.
Get adjusted.
Yeah.
Like for real. Just like do it. Just get adjusted. Yeah.
So you don't even have to go for a full care plan. Just get adjusted once in a while.
Yeah.
It's good stuff.
You'd be amazed.
If you need any help, we're here in Dallas, Texas. We'd be happy to help you out. You can check us out online at texasfhc.com. Our Facebook, our Instagram, and our YouTube. We like to monitor the comments and the situations there. So if you have any questions, throw something in there. I'd love to help you out with it. If you have any ideas for videos, please post it somewhere
down
so that I can give us some better ideas, find some things to talk about. Otherwise, we're just going to get a little bit more exciting when we talk about it. So until next time, we'll see you guys later.
Bye.